A very good day, my dear postgraduate students. Welcome to SNP, which means Short Notes in Pathology. And the topic for the day, hematopoietic stem cell transplantation, can be a short note or a short essay. Seemingly simple but difficult to answer. In the background, I am finding some cells which are round and they are having an increased amount of nuclear cytoplasmic ratio. That much is it. And thanks to Dr. Salim Balin for this wonderful picture, a thematic one, which shows a three-dimensional cell with moderately abundant cytoplasm and a large nucleus, increase in NC ratio. Beyond that, there is nothing much to identify. It almost mimics any other cell. By definition, the stem cells are undifferentiated cells with the capacity for unlimited or prolonged renewal and the ability to give rise to differentiated cells. These cells have the potential and differentiated cells have the function. Please remember that alone. And when I talk about the stem cells, there can be the uncommitted stem cell and the committed stem cell. Uncommitted means it can go in any direction, whereas a committed in one particular direction. And here is a bone marrow which will be containing the committed stem cells that we are going to talk about. These have got four actions, namely, one is self-renewal. That is what you and I are living upon. There is a constant renewal of these cells. Differentiation is to develop into a cell of function. And mobilization is out of the marrow. And can you imagine that you can find the stem cells in the peripheral blood itself? In fact, you can't find because of the morphology. Also, they undergo a programmed cell death. If it is going to be a continuous one, there will be a stem cell leukemia. The types of stem cells, these you people shall and will remember and draw. It can be embryonic stem cells or adult stem cells. And the adult stem cells themselves are being divided into the bone marrow stem cells and the tissue stem cells. So you find that there is a plethora of organs which can be having these stem cells. The list is given over here, including the brain, surprisingly. And in the bone marrow, you find that there can be the hematopoietic stem cells as well as others. My professor used to say that blood is a form of connective tissue because it contains a lot of matrix. And here I am finding the stromal cells, chondrocytes, osteoblasts, adipocytes, myeloblasts, and even the endothelial cell precursors. This type is of paramount importance. This again is a very important flow diagram thanks to Teresa Winslow. There is a blood stem cell which can differentiate into the myeloid or the lymphoid lineages, and from the myeloid again I am finding not only the myeloblast and the granulocyte but also the megakaryocyte and the platelets, as also the erythroblast and the red cell precursors. The sources of the stem cells can be the bone marrow, umbilical cord and the bloodstream. So this is again a simple thematic picture thanks to Immune Deficiency Foundation. The common indications for the stem cell transplantation can be allogenic, and these are the disorders you people know: acute leukemia, myelodysplastic, chronic myeloid leukemia, severe aplastic anemia, lymphoma, CLL, immunodeficiency, and hemoglobinopathies. And on the other hand, I find autologous, which can be progressive large cell lymphoma or the Hodgkin's lymphoma, multiple myeloma, and a relapsing germ cell tumor, which surprisingly has found its place in this, and it is there in any table that you can refer to. And this is a wonderful table thanks to ResearchGate. I would like you people to go through the entire list of non-malignant and malignant conditions and reproduce at least 4 or 5 from each of them, thanks to pediatric HSC transplant. There are some criteria for the donors which have to be followed, however it is not being so in some corporate hospitals. You find that the age has to be less than 70 years, the ejection fraction more than 45%. Serum bilirubin, you find that neither the patient nor the donor should be jaundiced, and the liver function should be within normal limits. Serologically, he should be free of hepatitis, HIV, B and C, and also HTLV1. And from the allogenic one, you find should be less than 50 years and a HLA matching should be done. This is a superb picture from the reference BioLegend. Look at this over here. Kindly follow what I say. There can be a primitive progenitor cell, and then there can be a committed precursor cell, and finally you can have lineage committed cells. The flow diagram is not over. So here I am finding the multipotential stem cell. Then there is a hematopoietic stem cell that is over here. And this can differentiate into the myeloid progenitor or the lymphoid progenitor. These again can be developing into the megakaryocyte or the granulocyte monocyte progenitors. So this is what I am finding. From the megakaryocyte, I will be getting the platelets. From the erythroid progenitor, I will be getting the RBCs. And from the monocytic and granulocytic, I will be getting the monocytes and the granulocytic series. And this will be the NK cell that is developing, the B cell, as well as directly you can get the dendritic cell. This is a superb diagram thanks to BioLegend. Cryopreservation is extremely important. You find that the stem cells are being taken or harvested, and it comes along with a good volume of blood. Therefore, the RBCs are being separated, and the stem cells themselves are made to join to each other by means of the antibodies. So again, clusters of these, and these again are being taken with lesser amount of fluid, and there is a reduction in the fluid, and this is kept in a preserve called as a cryopreserve. That is how the stem cell is being preserved. And before transfusion, it is being thawed or brought back to the temperature, made conditioned, and it is diluted. Finally, you find that the diluted sample is being transfused into the patient. Also, in some cases, you find that the patient can happen to be a donor who happens to be suffering from a malignancy. So there is a drain, and finally his blood itself is being transfused. These are the complications of the stem cell, somewhat similar to the blood transfusion and the allergic reactions. So in the early stages, there can be the nausea, vomiting, pharyngitis, infections, bruising, and anemia. You people will have to remember, because these are all similar to your pancytopenia and aplastic anemia. There can be a graft versus host disease and hepatic veno-occlusive disease. In the late stage, there can be an organ damage. There can be a relapse of malignancy for which it is given. Viral hepatitis, iron overload, drug injury, malignancy, and finally death. And this is an ecchymosis that is seen in a recipient. There can be a mutation in CHIP. CHIP means clonal hematopoiesis of indeterminate potential. So it has got an indeterminate potential. Pre-transplantation, this is how it is there. But post-transplantation, there can be mutagenic changes which can persist, which may result in malignancy. Kindly go back to the concerned article. So this is our friend, the stem cell. Looking at it, it is like any other thing. It is a round cell, slightly large, with a large nucleus, increase in NC ratio, and an opened out chromatin. Beyond that, there is nothing much. It is not like a megakaryocyte. So it is difficult to identify in the marrow or in the peripheral blood. Not so great. The stem cells are, this is a description that I have given, small in size with a large nucleus, spherical or oval. Sometimes the morphology can change depending on the state, whether it is going to be undifferentiated or differentiated, and in the culture conditions. Simple but spectacular. Here I am finding the hematopoietic stem cell, and here there is the osteoblast, the fibroblast, and the epithelial precursors. So any of this can turn into a hematopoietic stem cell or vice versa. In one of my classes, I have taken on metaplastic changes in the stem cell. So kindly go through that one. So it has got multiple potential interchangeable courtesy frontiers. A very fantastic diagram. This again, in a patient, you find there is a collection of the bone marrow, and it is a bone marrow precursor cells. These are all defective. The red line shows that there is some defect in it, and there are isolated CD34 cells with which it is treated, and they are modified over here. and finally they are reinfused in a corrected form to the same patient. It cannot be given as it is. The text of it is given over here. I would like you people to kindly write this one. And this is a sample diagram, again reinsert. The goddess of transmission. So this is Artemis over here. So transmission is supposed to be indicated by this one. A lot of other functions are also there. So the same series are the erythroid series or the megakaryocytic or the granulocytic series and the lymphoid series developing from it. Kindly go through this entire one and ultimately you get these cells produced by it. We have come to the end of the class, and always when there is an end, please recollect. There can be a definition, a history, types, indications, procedure, morphology, flow diagram, and complications. Think of the subheading will take you to the answer. Thank you.